Digital game-based interventions have proven to be popular and effective for promoting behavior change in a variety of contexts. Development teams for these interventions involve the expertise of a number of professionals. The Game Playbooks document, which draws on the strengths of health behavior intervention manuals and logic models, has been used by our team for more than a decade to support the development of multiple game-based behavior change interventions. During this time, we have modified and augmented the document to build on its strengths and more thoroughly support our teams throughout the entire design, development, and assessment cycle. We present our updated Game Playbooks format within the context of Cutie, a virtual reality game designed to support parents and caregivers of NICU infants in adhering to infection prevention and control practice, and offer the opportunity for caregivers to practice requesting good IPC practice from others. Cutie players take on the role of a human who has been assigned to be the caretaker and social media manager for the Cutie, an adorable alien ambassador that is extremely vulnerable to Earth germs. During each in-game day, the player is tasked with sanitizing and handing props to the Cutie and photographing the creature holding them for social media likes while maintaining clean hands and reminding visitors to the Cutie's room to perform hand hygiene. Our updated playbook format begins with a section detailing a project summary and intended users. Following this introduction is the formative work section, which is one of our team's additions. We began the Cutie design process by recruiting stakeholders to participate in a series of focus groups to identify underlying barriers, conflicts, and root causes related to performance of the targeted behavior. Focus group findings centered on caregivers remembering and knowing when to perform hand hygiene, and on potential concerns or lack of self-efficacy to remind healthcare personnel and family members to do the same. The Player Learning and Transformation Goals section translates the overall project goals and findings from formative work into specific goals for the project. This section has been restructured to include goals at 3 levels. As the pre-brainstorm sections of the playbook come together ahead of our team's formal brainstorming process, the document and the processes that create it help to spark ideas that may be brought to the more formal process. For example, our desire to avoid a simulated NICU setting based upon findings from the focus groups that such a game would likely add to caregivers' feelings of stress led us to the notion of an environment that drew from NICU layouts but removed the pressure of caring for a human infant. This, in turn, led us to consider what might be an appropriate subject of care, which included the idea that would eventually become the titular Cutie. Middle sections of the playbook aid the team in translating the goals of the project into clear principles to be considered during the design of the intervention. The curriculum content section furthers the specificity of the content that should be delivered by or practiced within interaction with the intervention. This section covers content to be delivered to the players in detail, written in layperson's terms and annotated by relevant learning goals. Following the curriculum content section is the extremely important theoretical framework section, which ensures that the intervention's design is thoroughly grounded in behavioral science. Immediately following the theoretical framework section is the behavior change construct section, which evolved from the 2014 targeted variables section. This playbook section draws heavily on the one before it and specifies exactly which constructs from the related theories of behavior change are to be targeted by the intervention and subsequently assessed during evaluation. The Game Playbook serves as a structured tool for mapping theoretical constructs onto game mechanics, ensuring that every component of the intervention explicitly links to a behavior change mechanism. In Cutie, self-efficacy, a key construct from social cognitive theory, is targeted through gameplay interactions where players practice advocating for proper infection prevention behaviors with NPCs that have varying attitudes and beliefs towards hand hygiene. This section is followed by the conceptual model, which expands on the logic model section in the original 2014 Playbooks outline. The leftmost game mechanics column, mappings between each set of elements, and annotation with numbered learning goals are new additions and allow the project team to ensure that all learning goals are covered and that decisions made at each level support the desired outcomes at the next. The intentions marker, also an addition, indicates the point in the model where assessment is targeted, outlining the role of intention in promoting the individual behavioral and broader outcomes supported by the intentions assessed. These middle sections are instrumental as early game ideas are further developed. For example, early iterations of Cutie did not include substantial opportunities for conveying knowledge-based curriculum content to players. As a result, We added newscasts played between in-game days to convey knowledge-based content about germ spread and best practices for using alcohol-based sanitizer to reinforce skills-based content presented through game mechanics. It is crucial that assessment strategies for a given intervention address the same constructs targeted by the intervention and reflect accurate and verified measurements of the constructs covered. We added an assessment reference section to the Game Playbook, which contains links and citations to publications with instruments that may be useful in evaluating intervention outcomes. The final Playbook section is the Game Components and Mechanics section, which undergoes significant development and modification over the course of a multi-phase design process. As the project moves into the software development period, the Game Playbook serves as a key touchpoint for the research and development teams to support a continued unity of vision for the intervention. As with other game development processes, the development phase of the intervention creation process is highly iterative and includes a great deal of moving between Game Playbook sections to inform design choices as they arise, and those design choices are subsequently recorded in the Playbook document. For example, early on in QD development, our team noted the need to alter the way the game handled an accidental QD germ exposure. In early versions of QD, the creature's illness was conveyed by displaying on QD's skin the same germ texture used to denote infected props and unsanitized hands. While consequences of letting QD handle a contaminated prop during a photo shoot were necessary to reinforce the need for IPC behaviors, no one wanted to see the adorable alien suffering. Initial playtesters would attempt to wipe away QD's germs with a disinfecting wipe. This leap makes perfect sense in the world of game logic, but the disinfecting wipes used in the NICU should never come into contact with delicate infant skin. A clear alternative to treat QD's infections in the game was added in a later iteration for this reason. As the project moves into the deployment and evaluation phase, the Game Playbook aids in the assembly of assessment instruments and priorities for what elements of the play experience and outcomes should be investigated and prioritized. The fully fledged prototype of QD is nearing completion. A small trial in the Yale NICU is planned for early fall 2025. The team will gather feedback from patient family members and visitors who play the game, as well as from the NICU nurses and staff to inform further development and streamline feasibility for wider distribution of the game. The QD Playbook represents the latest iteration of a document framework our team has been using and modifying over the course of more than a decade. These modifications comprise the addition of new sections and structures covering learning goal consistency, assessment reference, and formative work to provide strong rationale for curriculum, assessment, and design choices. We anticipate continued applications of this updated format in future projects and foresee additional evolutions as our teams develop new insights through its use.